mentioned, my name is Zaira Rebollar, and I am a community health worker and the operations director at Ready, Set, Smile. I'd like to start by sharing a little bit about my background. I received my bachelor's degree in 2021 from Hamlin University, majoring in public health with the hope of keeping my community happy and healthy. During my undergraduate career, I was introduced to Dr. Paul Farmer, a medical anthropologist and physician. I vividly remember watching his film, Bending the Arc, and being captivated by the work he and his colleagues were doing to fight for health equity. There was a segment in the film that showcased the community health workers he worked with and the tremendous impact they had on their communities. Years later, I found myself working at a private dental practice. It was a small startup office that had opened during the pandemic, and with one doctor and only one assistant, I got the opportunity to work in many different areas. Although this was an amazing experience that allowed me to grow in many aspects, I felt like I was ready for more after 2 years. After doing some research, I decided I wanted to become a community health worker. This realization came as many of the positions that interested me happened to either require certification or involved some sort of training. I had the intention of moving to Illinois, which is where I was doing my search for such positions, but after deciding to return to school, I decided to stay in Minnesota for my training. And upon further research, I decided to attend St. Catherine's University. I started at Ready, Set, Smile in 2022 during my last semester of my training. I started as an intern, and after 3 months, I was offered to become a full-time community health worker and to be their clinic lead. So my training as a community health worker was an incredibly positive experience. I constantly felt very inspired by my professors and my classmates. Regardless of my public health background, I still felt like I had a lot to learn. We covered topics such as our community health worker roles, advocacy, outreach, health competencies, and health communications, to name a few. The content, as well as the shared experience from my diverse professors, helped me become the CHW I am today. Like I mentioned, I started working at Ready, Set, Smile during my community health worker training, and I started during my last semester. Ready, Set, Smile's mission is to educate and provide preventive services to empower all children in our community to take care of their oral health. I have since developed a strong commitment with the students we serve at our 50 partner sites. Since working at Ready, Set, Smile, I have received extensive on-the-job training from various team members. On several occasions, our founder, Dr. Adele Delator, would tell me and any new staff that it takes up to a year to fully become comfortable with Ready, Set, Smile and its operations. This meant a lot to me given the extensive training that followed. The lead CHW taught me how to help families enroll in our program, how to add consent forms to our multiple systems, how to interact with families at school events, and briefed me on external clinics and resources where we can refer our families to. She and I worked for weeks to ensure I fully understood Ready, Set, Smile and its operations. Although I had interned for 3 months, this time helped me solidify my understanding in Ready, Set, Smile and everything that goes into running the program. This was also a very special time for me because it allowed me to continue building an even stronger relationship with my colleagues. At Ready, Set, Smile, we take pride in our commitment to education. We believe that educating children is crucial for empowering them and preventing dental diseases. Our founder, Dr. Adele, believes that this focus on education is what sets us apart from other programs. I spent a significant amount of time watching our oral health education series on Ready, Set, Smile's YouTube page. This series was developed by Ready, Set, Smile in conjunction with Dr. Brecky and other partners with the goal of helping staff and families get more education relating to oral health. Cavities, fluoride, oral diseases, and conditions are just some of the many topics in this 17-part series. Additionally, I dedicated time to learning about our education curriculum, which includes grade-specific lessons and engaging activities for students. In addition to the content of the education lessons, I also received training on how to deliver them effectively. Ready, Set, Smile's education consultant conducted a 2-day training for myself and other CHWs where we learned how to maintain student engagement, classroom approaches, and classroom management strategies. Following this 2-day training, I felt much more confident in my interactions with the students I educated. The clinical providers focused on the clinical aspect. We discussed common causes of decay in the populations we serve, the treatments we provide, supplies needed, and our standard operating procedures and protocols. My time at the private dental practice taught me a lot about the dental field, but I found myself learning even more during this portion of my training. It was at this moment I realized the many differences and similarities between running a private dental practice and a school-based program. I spent a lot of time learning how to classify children during our clinical visits. Children are classified as either low risk, meaning they have good oral health and no history of decay, or high risk, meaning they have previous restorations, active decay, poor oral health, or have a health condition that make them prone to decay, such as asthma. Some of our high-risk children may also need additional care beyond what we can provide in school. In some cases, children may be urgently referred or non-urgently referred, and sometimes they may just need an orthodontic referral. This was very important for me to understand, as often I was the one calling Spanish-speaking families to let them know their children needed additional care. Another significant focus for me was learning how to chart. At Ready, Set, Smile, we use iPads and a different software to chart, it took time for me to get accustomed to. Since I started working at Ready, Set, Smile, I've spent a lot of time connecting with students and families. Working with children brings me so much joy, and it's easily one of my favorite things about working with the organization. This past spring, I had a very meaningful interaction that I would like to share with you all. We were hosting a clinic at one of our 50 partner elementary schools, and we were stationed on a stage in a cafeteria. The 4th grade patient I had seated in my chair made it clear that the last place he wanted to be at was the dentist. He was not very happy or excited. Despite this, I engaged him in a conversation while we waited for our provider. I talked to him about what to expect at the dental visit, how to take care of his teeth at home, and the importance of lifelong healthy habits. As we talked, I could slowly see his attitude change. By the time the provider was ready to see him, he was in a completely different mood. He was engaged and asked a lot of questions about his cavities and the white spot lesions on his front teeth, which were early signs of decay caused by poor oral health. As the visit progressed, he stayed engaged and patiently waited while we completed our treatment. At the end of the visit, I quizzed him on the conversation we had while I prepared his oral hygiene goodie bag. I asked him how often he should brush and floss and what he can do to keep his teeth happy and healthy. He answered every single one of my questions right, and I was proud that he left feeling excited and empowered to care for his oral health, which is exactly what our mission at Ready, Set, Smile is. He left the chair with new knowledge that we hoped he would spread to his family and friends. We returned to that school the next day, and following our lunch break, I went to the stage to ensure everything was ready for the second half of the day. I overheard some students saying that they were looking for me specifically. At first, I was a little confused, but figured maybe they were students I had previously taught. We wear bright green Ready, Set, Smile t-shirts that make us easily recognizable, so it's not uncommon for us to get approached. Before I could greet the students, one of them proudly told me he had seen me the day before. He excitedly shared how he had gone home and brushed his teeth 5 times and flossed. He also mentioned how he had stopped drinking soda and started drinking more water. I couldn't help but smile throughout this entire interaction. His excitement was contagious, and all of his friends stood behind him, listening carefully. The student then thanked me for the new toothbrush, toothpaste, and floss, and for everything we had taught him the day before. He said he couldn't wait to see us again so we could see how well he had been taking care of his teeth. And as he left, he made sure to encourage his friends to sign up for our program. I've had the opportunity to interact with many students and families, but this interaction in particular will hold a special place in my heart. When I left clinic that day, I felt extremely proud of the work I was doing as a community health worker and to be part of Ready, Set, Smile. It was a clear reminder that I'm making a positive impact in my community alongside my amazing team. I started the apprenticeship program last September, and since the beginning, my wonderful mentor here has been there with me throughout this amazing journey. thanks to the apprenticeship program, I've had the opportunity to meet with my mentor quarterly, and that has allowed me to reflect on my growth and experience as a community health worker. My wonderful mentor has been and continues to be a key influence in my development as a community health worker. I greatly value each and every conversation we've had over the past year. I said this to her in our last meeting, but any future apprentice she mentors will be so lucky to have all of her amazing support. In June, I reached my first anniversary at Ready, Set, Smile, and due to the dedication to the mission, I was promoted to Operations Director. I have been in this role for 3 months now, and I find myself learning every single day. I am very grateful for the opportunity to be part of this amazing program, as it has opened up many doors for me. Back in 2022, I wouldn't have imagined myself in this position as the Operations Director of Ready, Set, Smile, or standing here sharing my experience with you all at this conference. I look forward to continue growing in this field alongside all current and future community health workers. I'd like to express my gratitude to everyone involved in this conversation for contributing to the growth of this field. Community health workers truly make a positive impact in the community, and I am privileged to say I get to see it every single day. Thank you.
Just a wonderful story about our first apprentice. Zaira is actually our first apprentice for the CHW TP program. So what she described is kind of like what we would like to see happen for many CHWs across the state of Minnesota. The information that I shared with you earlier about my personal experience, that did not come from apprenticeship. Unfortunately, I had to move around at different jobs and gain experience in different spaces, but that is what the goal is to have a well-rounded, trained CHW who fits the needs of your particular organization's programs and services. So thank you, Zaira, very much for the accolades, and we are so very proud of you. So registered apprenticeship, any state or any organization in the state of Minnesota can become a registered apprenticeship program with the help from the Alliance as well as the Department of Labor and Industry. The process is fully supported. The list of registered apprenticeship sites is available on our website. You can also just get that information by contacting me. Again, we provide step-by-step support for the site as well as for the apprentice.